Hello everyone, I am Gunce Beyazer. I'm moderating Istanbul City Council Migration Working Group since May 2021, since its foundation. Professionally, I work in the field of civil society to make cities more livable for everyone and to make urban services more inclusive. Our working group aims to be a democratic ground that aims to come together locally with migrants and refugees by applying the principle of sustainability, participation, and reconciliation, and to encourage them to be the agent of the city. We carry out studies on strategic areas so that migrants and refugees can benefit equally from all services in the context of urban rights and develop and maintain coexistent practices. Together, we aim to raise the demand for all kinds of policies to be developed for this city we live in from a point of view that respects human rights and the right of the city. Today, we are with you with the fourth broadcast of our interview series, which we planned as the Istanbul City Council Migration Working Group, which we will hold with the stakeholders of the City Council and experts from various files. There is a reason why we are starting this series of interviews today, in which we will try to look at the city and urbanism from the perspective of migration. We have chosen specially today for that because today, June 20th, is World Refugee Day. Since 2001, June 20th has been commemorated as World Refugee Day in many parts of the world. In fact, we know that some special days and events offer an opportunity to draw attention to some phenomena that we are already aware of and live in. On this occasion, we have prepared a program saying Istanbul is all of us. Let's defend life together in Istanbul, where more than 1.5 million migrants live. This is only an estimated number based on existing data. In our first broadcast today, Gizem Demirci Alkaddah from the Association for Solidarity with Asylum Seekers and Migrants, ASAM, and Özgür Aktükün from the Migrant Solidarity Association will be with us. In this context of human rights and urban rights, we will talk about issues such as international and national documents, legal status, urban services, and access to fundamental rights. Without further ado, I would like to hand it over to my dear Gizem. After that, we will be proceeding in the form of question and answer. Welcome, Gizem. Hello. Hello, thank you. I am Gizem Demirci Alkaddah and I am local coordinator for Marmara region for the Association for Solidarity with Asylum Seekers and Migrants, ASAM. I worked in a lot of positions for this association, and since 2011, I work as coordinator. I always work in Istanbul, and then we have been enlarged our work to Marmara region. First of all, I am very grateful for your invitation to Istanbul City Council Working Group. Istanbul City Council was one of our dream in progress. Again, I thank you and I'm happy to be here and answer your question. Thank you. And we thank you too for accepting our invitation. I want to begin with this question. In fact, after the 2011 Syrian migration, a very complex and multi-layered process is running from open door policy to hospitality, from Pazar Kule to the present. We are trying to live together with migrant group in a way, but there is still a lot of confusion about the migrant communities that we live and produce together. First of all, I would like to ask the following in order to use the concept correctly and in order for our audience to understand better in the continuation of the interview. Refugee, asylum seeker, migrant, registered, unregistered, without identity. Many concepts are used, each representing a different group, yet they have a lot of point in common. Each represents a different group. Can we briefly touch on the difference between these concepts? Of course, these concepts are very detailed and they can diverge as you go into detail, but I will try to explain it in the most basic way. First of all of these concepts define people who have left their country of origin and reside in another country and reside there. Let's look at the official status. When we look at the concept of migrant, it is our broadest definition. In other words, we can define migrant as a person who leaves the country of birth or origin and choose to reside in another country, regardless of the legal status or reason for migration. I give this definition in its broader sense. When we look at the other concept, we call an irregular migrant a person whose status in the country has become irregular due to the way the person came to the country. That is, whether he or she entered the country with a travel document or not, whether he or she fulfills his or her own legal responsibilities unintentionally or unwillingly during his or her stay in the country. This is actually an irregular migrant without identity, paper, or registering. Even going further and returning to definition, we find words such as fugitive and illegal. In fact, the most correct use is irregular migrant. In other words, the person may have entered the country regularly. During his stay, what happened? His visa expired. For example, he could not renew her visa. He could not apply for residence, or he did not apply. He chose this. In this case, that person's status become irregular, and we call this person an irregular migrant. Here, when we look at closely, this is a difference due to their official status as regular migrants and migrants. What can be under the concept of migrant? For example, he came here to study, he is a student, he is a foreign student. He came here to work, he is working, he has a work permit. He came here for marriage. All of these are different reasons and examples that fall under migration concept. When we look again, the reason for coming show a difference for us, especially in the definition of refugee and asylum seeker. There is one thing that comes to the fore in the definition of refugee and asylum seeker. It's a justified fear of persecution. That is, a person who has a fear of being persecuted for 5 reasons in his country of citizenship. What are these 5 reasons? A person who experiences fear of persecution because of his race, religion, nationality, membership of a particular social group, or political opinion. The asylum seeker says, I claim that I will be persecuted for this reason. The country evaluates this, that is, the relevant authorities of that country. If as a result of this evaluation, it is determined that the person's fear is real, we call that person a refugee. Countries can use some restriction with some agreements and conventions that have signed. Turkey is also a country that has signed the agreements that form the basis of these refugees, that is, refugees and asylum seekers with geographical restriction. In this case, the simplest explanation is that the definition is slightly different for those who come from outside the European country. Here we can say that the meaning of the asylum seeker is the applicant for international protection in Turkish law, and the meaning of the refugee is the conditional refugee. In countries from outside the European countries, we can also respond to definition other than the definition here with question from you, but it should be underlined that all these definitions are very permeable. In other words, A person does not become a refugee the moment they step into the country. When he comes to the country, he can be an irregular migrant, then a conditional refugee. While a conditional refugee is a conditional refugee, he or she may fall into an irregular situation once because he or she has not fulfilled his or her legal responsibilities. This person is a foreign student here, a regular migrant, but he may turn into irregular because he cannot complete the following processes. It is also important to keep in mind that it is very permeable, such as a war may break out in his country and he may experience a situation that prevents him from returning to his country, and a person may switch from a migrant to a refugee. Thank you. As I move on to the second question, I will try to ask it in a relation to the answer you gave in the first question. Here we come to the country. There are some processes, applications, convention. Who establishes this mechanism at the international and national level? And when were these mechanisms established? Because Turkey and Istanbul, throughout their history, have been in a position that constantly receive migration, also related to its geographical location. When were these adjustments made? So was it only done for Syrian case? What kind of procedure to migrants from other countries face? I think we can address a few of these in this question. A very important point is when this started. As you said, there is a misconception that everything started with Syrian migrants and foreigners coming from Syria. We can say that it became more visible to us or felt as a border neighbor. In fact, there is the Geneva Convention of 1951 and the New York Protocol of 1967, which form the basis of international legislation. In fact, national legislation develops in parallel with these protocols. This convention and protocols define the definition and scope of the refugees and set international standards in the services to be provided to these people. In our case, the law on foreigners and international protection (UC) is a law published in the official journal in April 4, 2013. But of course, they started working on it before that. What were we doing before that date, working in the field of migration? We were going through a regulation that we called the 1994 regulation. Our law was in 2013, but before that, of course, we had legal regulations. Regulation of 1994 was created after the Gulf War. The 1951 Geneva Convention, on the other hand, is a convention created for the whole world after the Second World War. In other words, the history of migration is very old, as you said, and all these regulations we are talking about are not a regulation on the first foreign influx from Syria after 2011. In fact, only the definition of temporary protection in the Article 91 in the UC is mentioned. Only its definition, only what is temporary protection. But after that, to whom the temporary protection will be provided, its scope, the services to be provided in that processes were regulated in a circular published after that. In other words, while the UC was being planned, it was not a planned law on the mass influx from Syria. Again, of course, there is not only this. Most countries signed the global refugee regime in 2018. This is the one of the things we call a soft agreement. That is less binding, but something that people aim to do. Here too, it's mostly said that this should not be the burden of only the country that received the migration. This is a global situation where it all needs to be shared globally and partner stakeholders come together, it states. Again, it would not be possible to pass without mentioning the names of the two actors. One of them is United Nations Refugee Organization in the global sense, and the other is the General Directorate of Migration Administration under the Ministry of Internal Affairs of Republic of Turkey. In short, we can say that the United Nations Refugee Organization is an organization that works to defend the right of stateless people, forcibly displaced communities, refugees, and to help them reach a better future. When it comes to the General Directorate of Migration Administration, we can say that it is the institution that regulates the migrants' arrival, stay, and leaving the country if they must be deported from the country, and provides the protection to be provided to the victim of human trafficking, those seeking international protection, and those seeking temporary protection during their stay here, and is responsible for carrying out all relevant procedures. As I said, the perception that all these were created only for Syrians is very common. When I started working in 2010, we were saying that there were around 20,000 refugees all over Turkey. Now we have many districts in Istanbul which are above this number with a population of asylum seekers and refugees. So of course, it became much more visible to the residents, to the local people. Here, of course, we have to look at the fact we sent 1.5 million at work in Istanbul. The number of registered Syrian is over 500,000. In other words, the rate of appearance of Syrian foreigners is more for local people. But when we look at it again, when we say that it constitutes something like 70% of the population, such a proportion of the population of Turkey in Istanbul, we can actually evaluate this population in something parallel. Again, we can say that there are some misconceptions about the rights of Syrian foreigners in Turkey. For example, the misconception that they go to the university without an exam is very common. However, they are entitled to go to university by taking the foreign student exam like every other student by taking the foreign student exam. Or there is a misconception that they vote in the elections, but only students can vote in elections. Such rights can only be granted for the person who have subsequently acquired citizenship. There are misconceptions that they receive salary from the state. This is actually not the state's aid. It's actually an aid received from a fund provided by the European Union to people with certain criteria and under certain economic criteria. Again, this is a salary approved by the state, not a salary paid to everyone unconditionally. I wanted to touch on this briefly with this question. Thank you. This issue of known wrongs is of vital importance for both the social cohesion and the development of the quality of life together. Because since 2011, there are many reasons, both political and urban, that is life related for the failure of that social cohesion to take place. Poverty, that is what we call urban poverty, the settlement of migrants on the outskirts of the city. Of course, there are many socio-economic reasons for this in the city. We will be talking about this later, but when it comes to the city, I would like to touch on this issue of local tax now. As I understand it, a large part of what we call migration governance is international, trying to be managed by UNHCR and the Migration Administration, but municipalities, as the closest administrative unit to the people, that is to the society, they receive a huge demand. So there is a very serious demand. We have all seen this very closely, especially during the pandemic. There is a burning demand, but there are some obstacles in the meeting this demand. Despite many political and legal uncertainties, since the beginning of this process, there were also municipalities that acted with a human-oriented and inclusive, right-based local government approach. On the other hand, there were also local governments that ignored and developed anti-migrant rhetoric. But we know the thing that is Article 13 of the Municipal Law number 5393 clearly states that the municipality is responsible for the provision of urban services to everyone living in the city. And the ambiguity created by the fact that the word citizen is mentioned in a small place in Article 14 is actually considered as, I say in quotes, an opportunity for local governments who do not want to do job and do not want to develop these services and policies. How is your practice of working with municipalities, that is, working with local governments? Can local governments ensure migrant inclusiveness in urban policies and services, especially on the basis of Istanbul? Requests, suggestions, good example. We would love to hear them all. You know, the municipal law is talking about the citizenship law, and this citizenship law actually corresponds what we have just said. That is, it means exactly the city for all. It is very inclusive. It says fellow countrymen, meaning everyone living in the same area. The European Declaration of Human Rights starts with everyone. That is, the people living in this city make up the city, whether they were born there or not, whether they are citizens of that country or not. Everyone who works in that country, who works in that city, who lives there, actually make up the structure, culture, and texture of the city. Historically, Istanbul is actually a city that embraced and continue to embrace this culture, this multiculturalism, this diversity, this color, this mosaic. That's why it's so important to keep this culture alive. Of course, when we look at it, there were different reactions. While some municipalities continues this directly through the citizen law, as you said, we have observed that there are reservations in providing service to non-citizens based on the article in which the word citizenship is mentioned. When we look at it, we can see that in 2021, especially in the Istanbul Metropolitan Municipality, this is done in all municipality on the basis of citizenship law. And these services are provided equally to everyone living in that town and city. Here, of course, things can happen in providing services. Sometimes there are only those who remain in the file of humanitarian aid, that is, at the level of urban poverty, while aid is distributed in regions that share the same poverty. There are those who go over this fair distribution, meaning that poverty is in everyone. Also here, as you said at the beginning, migration working group are formed in the city council, and this is a very good example. With the participation of migrants, refugees and asylum seekers living in the city, they now have a voice in decision-making mechanism and have a voice in the region they live in. We would like this formation to exist. We want them to increase as the representative of civil society. These are now more advanced steps, and here is one of the indicators that the mosaic, that inclusiveness, that unity we are talking about will be more effective. Such examples are things that we are really proud to commemorate on World Refugee Day. When we look at it again, the global refugee regime I mentioned earlier also says that cities and municipalities invite all of these common networks to innovative sharing by including migrants, asylum seekers, and refugees. In other words, innovative solutions should be found among partners, and these interventions should be made in the urban area in this way. Ours is a country where camp refugees are not so common anymore, so the camps are completely over, but only a small part of Turkey has camp. Urban refugees, urban asylum seekers, and migrants are already in the city. There is work here, they work here. There is a sustainable life here. We hope that these beautiful examples come from the province of Istanbul, or there are certainly other provinces as well. We are talking about Istanbul right now. It is seen more often that these examples are dispersed and spread all over Turkey, and that these innovative approaches have representative in decision-making mechanism. We sincerely hope that it happens. I want to ask one last thing, something that comes to my mind when talking about urban services and central government. There are different migrant groups living in each district within Istanbul itself. There are different places where they live in terms of density. While we are talking about Syrian in Sultanbeyli, we are talking about Africans in Shishli and as Uzbek, Turkmen, Afghan in other districts. In the continuation of local services, district municipality should develop something suitable for this model, maybe both in the context of social work and in the context of infrastructure. This is needed because what you mean by migrant is not a single layer, a single cloud, but here the data issue comes into play a bit. It seems that local government ability to keep the data will not be very fast on a platform where data and smart city are just beginning to be talked about today. This data actually has an owner. There are migration administrations that have at least registered data. How many children are at primary school level? How many migrants with disability? How many women? How many of these women have been subjected to gender-based violence? We know from the migration administration that local governments cannot get this data. We know there is a lack of coordination there. But I do not know whether the city's civil society collects these data through field research or whether it can receive support from the migration administration in this regard. We do not receive this data from the migration administration. We don't receive from the general directorates of migration administration or the provincial migration administration this information. In fact, we have the information that the people who apply to us choose to share with us. And of course, something that comes from being on the field for a long time. When we went to the smallest local administration, we know that they have a lot of to do with it. When you talk to a muhtar, he can tell you how many houses are there, migrant or asylum seeker living there, under whichever definition of refugees now. And this can go from the smallest local government that can reach to those upper levels. I can say that there are muhtars who are very interested and knowledgeable on this subject in the districts. We keep this registration ourselves and try to make files visit constantly. These file visits are not like something as the home visit we go door to door. They make appear all the authorities there. So you go there sometimes. Let me give an example through Syrians. There's a Syrian bakery, and for example, he knows naturally the area. But you are right. This data actually, all recorded data has an owner. There is an institution that keeps it, and sharing it with local governments and planning them will be very helpful. What is clear is that the same social group lives in the same environment with each other. That's why, in general, the municipalities have a lot of control over the thing. For example, let's say that migrants in Beyoğlu do not increase in the Cihangir region of Beyoğlu. Again, the population is increasing in region where the municipality is very dominant and where, let's say, the same social and economic level, the same urban poverty will be shared. Or when you ask in Avcılar, they will answer you, Yeşilpınar. There is nothing that surprises us in that district anyway. I mean, the ruling municipality is very much informed in this regard. There is also something like this. In the past, migrants preferred to stay in districts that we can call the city center or close to the center of the city. When we talked, we could send very specific places such as Africans in Fatih, Iraqis in Shishli, Kurtulistan. But this is both the figure that has reached 500,000 and the motivation to work for a longer period of time, and because of partnership, kinship ties, and the fact that his neighbor is coming. When a person set out from Syria, maybe he also comes knowing that his destination is a neighborhood in Sultanbeyli, that there is ghettoizations, that the group there is suitable for him, and he can adapt more easily. We can say that it increased different neighborhoods. Also, in this pandemic period, maybe our mobilization outside the neighborhoods has decreased, but the cooperation and solidarity within the neighborhood has increased even more. This should also be emphasized. During this period, the municipality also added everyone to their demands and service abundantly. Thank you very much, dear Gizem. I hope that the information you provide us was useful both conceptually and in terms of recognizing the mechanism, since it is the first publication of our interviews. Let's say we will see you on the file and in the work of the City Council Migration Working Group. See you soon. Thank you very much. My second interlocutor, who will be with us now, is Özgür Aktükün, Social Services Coordinator from the Migrant Solidarity Association. Welcome, Özgür. Hello, thank you very much for giving this opportunity. We thank you for accepting our invitation. Migrant Solidarity, can you talk about your association and what you do there? Our association is an association founded in 2016 and has been supporting refugees access to fundamental rights since its establishment in 2016. It has services in four main areas. We provide legal support, health support, access to education, and access to rights in other social areas. We have a team of experts related to these files. We work on request application. We try to ensure that our users have access to basic rights by directing them to the relevant units according to the request. Thank you. I want to start the question without wasting time. We are faced with the problem of access to health services, which has deepened and become more visible, especially with the pandemic. In fact, everyone's health is guaranteed in both international document and Article 56 of the Constitution. But in practice, each of us is also testing that this is not the case. In other words, since you are an institution that works directly on health, how are the services of public institutions and local government in the field of health distributed? What were the effects of Syrian migration, especially after 2011? I wonder how it was before and how the changes took place with the youth. Actually, our starting point here is international conventions, but it is also necessary to look at the structure of international conventions. Because access to rights related to refugees is not an area regulated directly by national law. Unfortunately, international conventions, including the Convention on the Rights of the Child, give nation states the right to make arrangements in their domestic laws according to their own structural needs and resources. Although it defines health for everyone as a right, international convention, the same conventions, also say to nation states that you can regulate this fundamental right to the extent of your own resources. In other words, this provides the justifications for the obstacle we encounter in the exercise of this fundamental right. For this reason, we can make some initial criticism that international treaty texts have left such a wide and deep space to make restrictions on nation states. This entitled the right not only to the right to health but to all other fundamental rights. It's a bit called program provisioning. Since the program is of a provisional nature, everyone has the right to make arrangements and restrictions according to their own resources, limitations, and the political situation of the nation state they are in at that moment. This is also the basis of the difficulties and restrictions we have encountered regarding the access we are in. Although we have signed these national conventions, we are exercising the restriction rights granted to us in our domestic law. And of course, another factor is the change in the structure of migration, especially the change in the position of countries like Turkey on the migration map is extremely defective in this. Why is that? Until 2011, maybe we can put this as a milestone, or rather the 2010s. While Turkey was a transit country, it became a target country, especially with the migration from Syria after the civil war in Syria, and brought a very serious refugee population with it. Especially after the Syrian migration, people from other geographies who used Turkey as a transit country started to see Turkey as a target country. This has caused the refugee population here to increase dramatically. Of course, the fact that the Syrian migration took place with a very large mass in a very short time, unfortunately, it could not be developed the ability to produce an answer at the same speed in the transformation of the public structure here. In fact, this is perfectly normal. Other countries could have experienced this problem as well. When the first circular were published in 2011, basic and emergency health services were included in the scope of international conventions. There was a camp-oriented migration governance process at first, but later on, due to the cost of the camps and the inability to deliver qualified service to the camp environment, the camps were liquidated and people were placed in the provinces defined as satellite provinces, where another problem was encountered. The choice of satellite provinces was a challenge, and serious problems were encountered in people's access to basic rights, as the population was directed there without adequate public service transformation in the selected satellite provinces. Between 2011 and 2015, many changes were made, especially among health services. Services are still being delivered through various protocols between Provincial Migration Administration, AFAD, and the Ministry of Health. Here, of course, the basic criterion is that although health is presented as guaranteed, being registered and unregistered in the legal regulation in Turkey is the determining factor in access to health. In other words, the capacity of health services that a registered refugee can reach and the capacity of those who have to live unregistered in Turkey are very different from each other. It was originally defined as only emergency and primary health care for registered people. However, in 2015, a new protocol was included in the scope of tertiary health care services for those registered. What kind of a problem do we encounter in accessing the registered migrant here? First of all, the language barrier is the biggest barrier, the biggest problem. It is still not an handled problem. Again, there's a new health service model created under the umbrella term of migrant health centers. There are really big problems with the capacity of migrant health centers. The fact that the primary health care service offered there are confined to a very narrow area and the coverage of a very basic level of service leads people to go to the hospital with more advanced systems. However, they face serious problem in terms of access because there are not enough translators in hospital. The appointment system is still monolingual. Refugees do not know the structural functioning of the hospital, and the referral system still do not work properly. Another is that there are problems encountered in the health system, especially regarding the scope of emergency health care, because the triage model is applied in emergency health services in Turkey. There is a three-step emergency health model, more precisely three colors. The red ones are the section reserved for life-threatening patients. In other words, if the person's life is in danger, he gets service from the red area. Again, the yellow area is not life-threatening, but it is the department where those who have applied to the emergency room due to the serious illness or a serious health problem receive service. There is also a green section. This is the case where the patient's waiting does not pose any risk to the patient's life safety. Here, of course, people who cannot access polyclinic services, who do not know the language or the hospital system, crowd in green areas. Refugees do not know the emergency service, the circulation system very well, and this turns into a separate problem in the hospital system, causing people to encounter various problems in accessing health services. Again, due to the inability of maternity services in the emergency system, there are serious problems in accessing maternity services for refugee women, especially for unregistered refugee women. This poses very serious risk to life. Another side effect of this problem is that at this stage, refugees learn the difference between being registered or being unregistered in accessing the hospital system. Thanks to their work, obviously thanks to civil society. However, unregistered women who have to give birth or pregnant due to the fact that the maternity service is not within the scope of emergency go to the clinics under the stair, and there are very serious field observation about this. Or it is related to the access of babies to health services, such as giving birth at home without access to any doctor, without any health checks, giving birth on their own, in a way that puts both the baby's and woman's life at risk. There is a very serious problem, and we are trying to create a very serious awareness about it, especially NGOs, before the public. Unfortunately, no results have been obtained yet. Finally, we need also say this. We need to raise awareness, especially in this COVID-19 process we are going through, because in all directives issued since 2011, it has been stipulated that infectious diseases and emergency health services are provided to everyone without discrimination. For this reason, people who need any health service due to the vaccine and COVID should apply to hospital regardless of whether they are registered or not. There is already a provision for this. We encountered some resistance regarding this in hospital during the process, but this is entirely due to the fact that the public personnel in that hospital do not have enough information about the regulation. And in this sense, we are looking on the hospital staff to access sufficient information about the regulation and to guide pipe. Where are local government in this? Unfortunately, local government are not very active in the field of health. It is not known by the refugees whether they provide a health service or not. We are working on expanding the scope on this subject. First of all, we are doing extra studies on the benefit of refugees from the health centers of local governments. In particular, various studies are being carried out to enable refugees to benefit from health centers of local governments, but unfortunately insufficient. Actually, I was going to ask the question about local governments later, but while I'm on the subject, I would like to ask a concise question. As far as I understand, the central health system does not have an inclusive mechanism for migrants. It cannot be implemented both on paper and in practice. In fact, the health system is also complex for Turkish citizens. When we go to a hospital, there is great confusion about where and how we will benefit, what insurance pays and what does not pay. But here's what caught my attention. You said that there is a development about infectious diseases by these central social policymakers, but in all other cases, they are left to die. And they are left to deal with this disease. That migrants are not only going to doctor with this disease, but also for a state of well-being psychologically in mental health. It's part of it. For local governments, there's a mechanism that covers all these services from birth to death. You said that when unregistered migrants go to hospitals, they encounter resistance. So, not to treat the patient within this resistance, or is there a way to report that it is unregistered? Are they pushed to settle the matter with police? There is deportation, etc. at work here. This must have a frightening effect on migrants, especially undocumented migrants, in accessing health services. Therefore, if you don't have private health insurance, you cannot go to a private polyclinic. All these things you have said are in the content. Let me put in this way. For example, what you have said so far is registered temporary protection or international protection, but unfortunately, an arrangement was made in 2019 in international protection. Those who previously applied for international protection could have access everything, including the tertiary health service specified in the regulation, just like in temporary protection. And they could get hospital and medicine services under that general health insurance. However, a regulation was made in 2019 and the universal health insurance coverage of international protection applicants was limited to 1 year. And this has caused serious grievance because especially in the beginning, there was a problem encountered like almost everyone's general health insurance was cut off. And the new regulation was made by making an additional regulation, and it was said that those with special needs will apply to the Provincial Migration Administration, and if their situation is evaluated, if the Provincial Migration Administration give consent, these people will be included in the scope of general health insurance. But as a criterion, they will have to prove that they have special needs. and this has created serious grievance. And unfortunately, this regulation is an effect. Unfortunately, those who have international protection are limited to 1 year. In other words, they can only benefit from free health service for 1 year. Refugees don't have the opportunity to apply to private health institution. They cannot go directly to the private health institution. However, the existing regulation allows them to benefit from the public. Because the following has been added to the new regulations, whether in public or private, and the obligation to notify private health institution has been introduced. In other words, when a person applies to a hospital when he is unregistered, he always gives an obligation to notify the relevant public institution, which is directly the police for unregistered people, in order to be able to put him into the system, in order to be able to provide hospital treatment service, no matter what he applies to. Of course, this notification obligation was really problematic for hospital. The doctors resisted it. We are physicians and we have an obligation to treat, they said, due to professional ethics, but they also have responsibility against the existing laws. This time, the physicians started to have problems because there were also those who underwent investigations. Although it is included in the scope of health in terms of visibility, the inadequacy of this infrastructure and weakening of the social state principle of the public health system, which is really affected. As you mentioned, it should be underlined that not only the refugee but also the local people were adversely affected. The places are not particularly health-friendly, and there is a serious problem in terms of access. Syrian hospitals are really hard to find where it goes where. And as you said, when they think about the problems of they will experience there, they turn to other structures that will exploit them. And this causes them to face really serious problems. For example, dental health is the one we have the most trouble with. In particular, no NGO can provide services in dental issues. Access to public service is really difficult in dental health, but you cannot put dental health aside because it poses serious risk when considering bodily integrity and health. I want to re-emphasize the issue of local government. These are really the most basic measure in front of people's access to quality service. While it's possible for them to expand the field of women's and children's health, unfortunately, they do not act on this issue. They are extremely reluctant to benefit refugees from their own health centers, even for registered one. In other words, in any way, any local government does not have any interpreter in its health centers or does not announce it. We have such a health center, it doesn't give you visibility like you can benefit from it, and it doesn't do it specifically. This issue is really an area where some local administrations fail in making the refugees benefit from the health service they provide. Actually, this was one of the things I was going to ask when I interrupted by saying two, namely the health services of the municipalities. I think there are only centers where they can provide primary health care services. Yes. I remember there were 3 in Istanbul, and all 3 of them are in area where migrants live heavily. There are 3 centers in metropolitan municipality, but district municipalities have more centers. District municipalities are working less on this issue. Of course, it is necessary to keep a few municipalities separately. They really do special studies on this issue with disadvantaged groups, but I underline here that local governments can do much more on maternal and child health. Of course, secondary and tertiary services may be outside their scope, but at least medicine supply for the elderly or basic examination service, women's health services for women, child health services for children, and these are within the scope of local government. Social services are also one of the things that will increase the coverage area. Finally, I would like to ask a few questions about this COVID-19 process and vaccination. In other words, various local governments in various parts of Turkey try to do something in COVID-19, no matter which party or political idea they belong to. There were those who opened their health centers instantly within a week. But then, with a circular, this form of health was prevented from being given. This is both a legal and a political obstacle, not only for migrants, but for everyone living in the cities. It has paid off. But migrants face multiple discrimination in hospital in this process. We know that the rate of going to the hospital is very low for these groups, such as LGBT migrants and migrant groups with children. But on the other hand, because they have to continue to work and live together in the crowded places, I read in a research of the Migrant Studies Association, if I remember correctly, that the spread was 18%, 0.18% among Turks, while the rate of spread was 1% among migrants. Despite this, they are in a state of reservation. We hear and watch from the field that they have the same reservation about the vaccine. I want to ask about this vaccine. Where are the migrants in this vaccination program, and do they have a prejudiced and timid attitude towards vaccination, just as they are afraid to go to the hospital? And what kind of mechanism can civil society realize in this area? Most recently, we as the Migrant Solidarity Association organized a meeting by bringing together various NGOs and the Science Board of the Ministry of Health, and only the municipality of Şişli participated from the local administrations. And at the same time, it was a meeting with the representative of the ministries, during which various views were exchanged on refugees' access to hospital and treatment service during the COVID-19 process. Which we talk about from the very beginning, have increased even more during the COVID process. They were hesitant to go because there was another problem. Civil society also withdrew from the field, and the language barrier has multiplied. In other words, they have become inaccessible to many NGOs, even with telephone service. Accompanying services have already been completely stopped by NGOs. This made the process even more difficult for them. The outpatients clinics in hospital, especially during the period when COVID-19 attacks, the interruption of those polyclinic services created a very serious problem for those with chronic diseases. Appointments that could not be made have been cancelled. As a result, they did not go even if they needed to, because the risk of applying to the hospital environment increased the risk of catching that disease. And on the vaccine issue, our research has not yet been completed. I'm conducting a vaccine research in 5 provinces. But when I examine the existing answers, I see a picture like this. I'm observing some difficulties in knowing what the vaccine is. So I can't say it's certain because I don't have the data, but this is one of the things I have observed. What is a vaccine? Since the vaccine is perceived as a therapeutic drug rather than a protective one, we have such observation from the answer given to us. I'm not sick, so why should I get vaccinated? I don't show any symptoms. Why should I get vaccinated? This answer is beginning to given us frequently. Again, troubles with knowing how to access it. So what can we do? There's a problem with the awareness of even this, which needs to be underlined. I can't say anything about this since I haven't had much discussion about it, but from the very beginning, infectious diseases, pandemic diseases, are within the scope of diseases that have the right to basic protection for everyone, whether registered or not. Therefore, as in other health services, the condition of being registered or unregistered is not required in accessing pandemic services. This is directly included in the regulation because it has been recognized as a pandemic by the World Health Organization. For this reason, since it has the status of an infectious disease, any person has the right to access all kinds of treatment, medicine, and vaccine, regardless of whether he is a citizen of that state or not. A study needs to be done on this one. It is necessary to tell them correctly the difference between the two. That the vaccine is a protective mechanism, that the treatment service is not a therapeutic drug, but a preventive drug. Again, it's necessary to tell them that they will not encounter any problem with access, because the unregistered, for example, may think that they are deprived of it because they cannot access normal health care. For example, awareness studies should be carried out to show that this is not the case, that everyone has access to vaccine, and that they are legally entitled. Here again, the most important task falls to local governments. Local governments should also be a part of awareness activities. They need to increase awareness activities by cooperating with NGOs on this issue. We will be taking the initiative to ensure coordination between both local government and NGOs by fulfilling its responsibilities as the City Council Migration Working Group. There were some documents that we prepared together with the Turkish Medical Association. Even though we have provided a little bit of their distribution through the institution in the file, some technical works such as language barrier, translation, dubbing, subtitling can slow them down a bit. But when it comes to health, especially when we say let's defend life together and raise this demand, doing these works and taking the responsibility, I think it's important too. Absolutely. I agree. Thanks, Özgür. I thank you very much for giving this opportunity. I really want to call again from here. Please, everyone get their vaccinations. The vaccine is the only thing that will protect you from that. Don't hesitate. There is no obstacle for you to reach the vaccine. In this regard, both NGOs and the nearest health service centers will help you. It will guide you. We even make appointments when necessary. Allstock provide this service to those who want to make an appointment. It needs to be expanded. Getting vaccinated is really important for the health of all of us. Please do not neglect this. Thank you so much. We will be diffusing these messages by translating them into different languages. Thank you so much. Thanks. I hope your voice will spread to every corner of the city. Thank you, Özgür. Thank you for such a work. I would also like to thank the Istanbul Metropolitan Municipality and the Istanbul City Council and wish them all the best. We would like to thank Gizem Demirci Alkaddah and Özgür Aktükün for their valuable contribution and participation. Our interviews, which we started today on the occasion of June 20th, World Refugee Day, will continue. We will continue to talk and produce with experts from various fields, migrants, civil society representative, local government and public representative, on how we can establish a coexistence in the city and how the city can be made more inclusive and livable for everyone. We will continue to defend life together. I send my love to everyone who listen and watch. See you.